Uncontrollable urine leakage. What your body is trying to tell you. Have you ever leaked urine when you weren't expecting it? Maybe it happened while laughing, coughing, lifting something heavy. Or perhaps you suddenly felt such a strong urge to urinate that you couldn't make it to the bathroom in time. If so, you're not alone. Millions of people experience urinary incontinence, also known as involuntary urine leakage. The good news is that urinary incontinence is not a normal part of aging, and in many cases, it can be improved or even treated. In this video, we'll explain the most common causes of uncontrollable urine leakage, what you can do about it, and when it's time to see a doctor. What is urinary incontinence? Urinary incontinence simply means losing urine without intending to. It can happen occasionally or become a daily problem. For some people, it's just a few drops. For others, it can significantly affect work, social life, exercise, travel, and sleep. Many people feel embarrassed and never seek help. But urinary incontinence is extremely common, and in most cases, there are effective treatments available. Type 1. Stress incontinence. Despite the name, this has nothing to do with emotional stress. Stress incontinence happens when pressure inside the abdomen suddenly increases. Common triggers include coughing, sneezing, laughing, running, jumping, lifting heavy objects. When the pelvic floor muscles or urinary sphincter become weaker, small amounts of urine may leak during these activities. Stress incontinence is particularly common after pregnancy and childbirth, but it can also occur after prostate surgery in men. Type 2. Urge incontinence. This type feels very different. Instead of leaking during movement, you suddenly experience an overwhelming urge to urinate. The urge becomes so strong that you simply can't reach the bathroom in time. This is often caused by an overactive bladder. People frequently describe it as, "I have almost no warning." Triggers may include hearing running water, unlocking the front door, standing up after sitting, drinking coffee or alcohol. This type of incontinence can happen both during the day and at night. Type 3. Overflow incontinence. Sometimes the bladder becomes too full. Instead of emptying normally, small amounts of urine continuously leak out. This is called overflow incontinence. Common causes include enlarged prostate nerve damage, diabetes, certain medications, bladder muscle weakness. People often notice a weak urine stream, difficulty starting urination, feeling that the bladder never empties completely, constant dribbling. This type requires medical evaluation because urine retention can eventually damage the bladder or kidneys. Type 4. Functional incontinence. Sometimes the bladder works perfectly well. The problem is simply getting to the toilet in time. This can happen because of arthritis, difficulty walking, neurological diseases, poor mobility, memory problems. In these situations, treating the underlying issue may significantly improve symptoms. Common risk factors. Several factors increase the likelihood of urinary incontinence. These include aging, pregnancy and childbirth, obesity and large prostate, prostate surgery, diabetes, neurological disorders, chronic constipation, smoking, and chronic coughing. Having one or more of these risk factors doesn't mean you'll develop incontinence, but they do increase the likelihood. What can you do? Fortunately, there are many treatment options. The best treatment depends on the underlying cause. 1. Pelvic floor exercises. Strengthening the pelvic floor muscles is often one of the first recommendations. These exercises can improve bladder control over time. Consistency is important. Many people notice improvement after several weeks of regular training. 2. Train your bladder. For urge incontinence, bladder training can be very effective. Instead of rushing to the bathroom immediately, your healthcare provider may recommend gradually increasing the time between bathroom visits. Over time, this can help reduce urgency. 3. Reduce bladder irritants. Some foods and drinks can make symptoms worse. Common bladder irritants include coffee, energy drinks, alcohol, carbonated beverages, spicy foods. Not everyone reacts the same way. Keeping a bladder diary may help identify personal triggers. 4. Maintain a healthy weight. Excess body weight increases pressure on the bladder and pelvic floor. Even modest weight loss has been shown to improve symptoms in many people. 5. Don't ignore constipation. Many people don't realize the connection. A full bowel can press against the bladder and worsen urinary leakage. Treating constipation often improves bladder symptoms as well. 6. Medications. Depending on the cause, medications may help reduce bladder overactivity or improve bladder emptying. However, medication is not appropriate for everyone and should always be discussed with a healthcare professional. 7. Surgery. In some cases, surgery provides excellent long-term results. For example, sling procedures for stress incontinence, artificial urinary sphincters after prostate surgery, procedures for enlarged prostate, other specialized treatments depending on the diagnosis. Your urologist can help determine whether surgery is appropriate. When should you see a urologist? You should seek medical evaluation if leakage is becoming more frequent. It affects your daily life. You have blood in your urine. You have pain during urination. You frequently develop urinary tract infections. You cannot empty your bladder properly. Symptoms started suddenly. Remember, urinary incontinence is a symptom, not a diagnosis. Finding the underlying cause is the first step toward effective treatment. Final thoughts. Uncontrollable urine leakage can feel embarrassing, frustrating, and isolating. But it is far more common than most people realize. More importantly, you don't have to simply live with it. Modern medicine offers many effective treatment options, from simple lifestyle changes and pelvic floor exercises to medications and surgery. The sooner you seek help, the more treatment options are usually available. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more evidence-based urology and men's health content. And remember, losing bladder control is common, but suffering in silence doesn't have to be.